Okay, so I'll start, I guess, while you try to figure out how to. Oh, it's recording already. Okay, wonderful. Right. Okay, so let me share screen. All right. So can everyone see my screen?
Yes.
Yeah. Okay, wonderful. Okay, so what I'm going to do is, I think what went out in the email basically is something around mental health and taking care of your mental health in the COVID-19 pandemic. I'm trying to, what I'll do is I will cast the net a little bit wider and not just look at mental health, but try to speak about some of the other issues around coronavirus and COVID-19 based on my experience of the interactions with our staff. Hello? Hello?
Yeah, hi.
Hi, sorry about that. It's my dog who just doesn't seem to understand that there's something called as Zoom meetings and he shouldn't be kind of pulling out wires. Okay, right. So as I was saying, I'm going to kind of spend some time looking at not just the mental health aspects of COVID, but looking slightly beyond that at some of the medical aspects of COVID-19 and coronavirus, putting on my hat as a medical doctor. And most of this is based on personal experience of interacting with staff and some of the challenges that we have had while interacting with some of our staff here in the ARC and also interacting with other people beyond Sankat. I'm not going to kind of keep this too long because I think we need to spend more time trying to address questions if you have those. But I'll also kind of cover some of the bits related to the actual topic that was handed over to me, which is mental health and COVID. I'm not going to spend too much time on that because a lot of us have been working in this field, and some of you might think, oh, I know this already, and I don't want Abhijit to be telling me about this. Right, so I'll start off with a disclaimer, and the reason for the disclaimer is very simple. As we all know, over the past few months, the situation has been pretty fluid when it comes to the coronavirus and COVID-19. In terms of our understanding of the virus and what it does, and also in terms of the various guidelines that come from government and other agencies, which keep on changing, and rightly so, considering the fact that the situation is evolving pretty quickly, and we have to be responsive to the changing situation, and hence some of the guidelines change sometimes on a daily basis, especially in Goa, which means that something that I say today might no longer be valid tomorrow or a week later. So what I'm saying today is valid today. And we have to be mindful that the situation changes, and we have to keep an eye on the changing situation and the changing guidelines. So a lot of the things that I'm saying today are based on the current knowledge and based on current guidance. Again, I'm just going to kind of not go into detail in some of these things because all of you have seen this or heard about this quite a lot over the past few months. So this is just to kind of reiterate some of the things that we have come to know or learned over the past few months. And I just want to reiterate this because as time passes, it's human nature to get into a comfort zone and not pay attention to some of these things that are very, very important. Because as we get comfortable with the situation, it's highly likely that we don't take some of these things very seriously. As we get immune or inured to the numbers that are coming out from the various agencies in terms of the number of people getting affected or number of people dying from the virus, etc., we tend to get a little bit lackadaisical about the precautions that we need to take. And hence, I'm not going to spend too much time on this. I'm just going to leave this slide on for a few moments just to reiterate the fact that the way this virus spreads basically is through droplets. So when people cough and sneeze, we come into touch with those droplets, and when we touch our face, our nose or eyes or mouth with the hands which are infected, that leads to the spread of the virus. And this virus can stay on various surfaces for different periods of time. And again, there is debate around this for how long the virus can survive on various surfaces, and it varies based on the kind of the surface it is. And we will not get into a discussion around that. But the most important thing to remember is they can stay on surfaces. And so you don't necessarily have to be directly coming into contact with someone who is COVID or coronavirus positive, has COVID-19, and is sneezing and you kind of inhale the droplets directly. You could get the infection by touching things which have been touched by someone who has had COVID-19, and then you kind of transfer it through your nose, through your hand to your nose or mouth. So just to be mindful of that, that has not changed. That's remained the same since the start of the pandemic. That's not going to change very quickly in the coming times. So please be mindful of this. The other thing that I've come across quite frequently, and this will again change based on which part of the country you are in, is someone in my village has tested positive. I want to get tested. We need to remember that although we might want to get tested, it's not so easy to get tested, okay? And sometimes it's pointless to get worried about these things and wanting to get a test done just because someone in the vicinity that you're living in has tested positive. So there's no point in getting worked up. There's no point in saying, I want to get a test done. There are very clear guidelines from the ICMR, and most of which are followed by most states in India are these. Many of these are going to be irrelevant generally to all of us. And the ones which are in bold here are the ones which are relevant to all of us, which is all symptomatic contacts of laboratory confirmed cases. So if you have come into contact with someone who is a confirmed COVID-19, that's when you will get tested. If you have come into contact with someone confirmed, okay, someone who has tested positive, that's number one and going to be the most common and most likely one that asymptomatic direct and high risk contacts of a confirmed case. So you have come into contact with a confirmed case, or you are a high risk contact, which is not going to be for most of us. And finally, all symptomatic within hotspots and containment zones. So if where you live has been declared as a hotspot or a containment zone by the government, and you are symptomatic, then you will get tested. Everyone within a hotspot or containment zone is not usually going to be tested for coronavirus or COVID-19 unless they are doing community screening, which is very, very unlikely considering the low resources that all state governments have at the moment. The others are not so relevant on a kind of a more general scale because international travel in the last 14 days is now more or less irrelevant for most of us. None of us are going to be frontline healthcare workers involved in containment and mitigation of COVID 19. So, unlikely or almost impossible for almost all of us. And then the other two, all patients of severe acute respiratory infection and all hospitalized patients. Obviously, if you're having SARI, you're going to be admitted. And if you are admitted because you have symptoms, you're going to be tested automatically. It's not something that we have to worry about. So the things that we have to remember are those three that we have put in bold there. If you have come into contact with someone who is a confirmed case, then you're going to get tested. So no point in asking for to be tested if you think that there is someone in your vicinity who has COVID-19. So no point in kind of worrying about that, no point in trying to get tested for that. The other thing that we come across pretty frequently in the work is someone in my village has tested positive. I will stay at home for the next 3 days and not come to work. That does not work again, in the sense that just because there is someone who is positive in your village does not really mean that everyone in the village will get infected by coronavirus or COVID-19. Or you might come into contact and you might have coronavirus, but you might be asymptomatic, and we'll never know unless you are tested. So the only reason, the only reasons why you would not come to work if there are corona positive cases or COVID-19 cases in your village or vicinity is if you yourself have been diagnosed as a very mild case or a pre-symptomatic case by a doctor, in which case you should be self-isolating at home. If you have the facilities to do that within your accommodation, if you have a caregiver who is able to provide care on a 24/7 basis, and there's a clear communication link between your caregiver and a hospital. These are the only reasons why someone will be self-isolating at home. The most important being that you have already been diagnosed to have a mild case or a pre-symptomatic version of COVID-19 by a doctor. There is no other reason, unless you want to be kind of keeping yourself 100% safe and not wanting to risk yourself in any way, which is not anyways going to be possible. There is no other reason for anyone to say there's someone in my locality who is tested positive, so I will stay at home for a few days. So be mindful of that. The other things that are expected of someone who is self-isolating is this. I won't go into details of this because obviously if you've been recommended self-isolation by a doctor, they are going to tell you all of these things that you need to do. So again, we won't go into the details of this. The more important bit is this, which is trying to do away with some of the worrying and panic related to people in your locality or community becoming positive. We have to remember that the virus is spreading. We have to remember that that's not going to stop. If I could request those who are not talking to mute your microphones, please. So the virus is going to spread. That's not going to stop. We're just about getting into the peak of the spread of the virus in the community. So we are going to see more, increasingly more cases of COVID-19 positives within your communities. And so unless your community has been declared as a hotspot and your whole community has been declared a containment zone, there is no rationale for you to be locking yourself up in homes unless you're kind of going to do that until the pandemic dies, and we don't know when that's going to happen. The other thing is around medications. I mean, there are lots of reports of people taking a range of medications which are known or which are claimed to be helping you boost your immunity or reduce the risk of developing either COVID-19 or reducing the impact of coronavirus on you if you get infected. The most common one which is bandied around is hydroxychloroquine. So my sincere request to you is not to take any medications for COVID-19 or coronavirus unless they are prescribed by a registered medical practitioner. Many of these medications like hydroxychloroquine come with a lot of side effects, and hence we shouldn't be taking them. We shouldn't be buying them over the counter. We shouldn't be taking them without a medical practitioner's advice. So please, please, please stay away from any kind of medications which claim to boost your immunity against coronavirus or COVID-19, or which claim to protect you against the more severe effects of coronavirus or COVID-19. Any medications that you take should be under the supervision of a registered medical practitioner. So bottom line is, whatever you see on WhatsApp, whatever you see on social media, whatever you hear on news channels, whatever you read on any social media channels, the bottom line is there are 3 basic reasonable precautions that we should be taking. Everything else, anything else that is put into action, if you have coronavirus infection or COVID-19, you test COVID-19 positive, has to be based on the recommendations of medical professionals and as per the guidelines of the Ministry of Health and Family Welfare or the state departments of health. So the reasonable precautions, which we all know by now, which I'm sure all of us are practicing, is hand washing, wearing masks, and maintaining physical distancing. Now, these recommendations on social distancing keep on changing. The one which I have up here is 3 feet. Some recommendations say 6 feet. My advice is maintain reasonable physical distancing. Try to avoid crowds. Try to avoid situations where there are a lot of people coming together or congregating, because that's high risk. And maintain at least between 3 to 6 feet of social distancing. These are the only reasonable precautions that we can take if we are not infected by the coronavirus. Anything over and beyond this, if you are not infected, is unreasonable and unsustainable in the current circumstances. So if we stick to these 3, we're kind of greatly reducing the risk we have of getting coronavirus or COVID-19. The problem is, as we kind of look around us in the communities, we see that people are not following this, but trying to follow unreasonable things that they read on social media. So don't do any of those. If we do all 3 of these, we are reducing our risk greatly. The problem is that as we get more comfortable with the situation, as I said, the chances of us not doing these things increases. And this is not unusual. I mean, this is something that we see in any kind of a long-term situation where we have to maintain or sustain behavior changes. We see that as we get used to the situation, the change in behavior that we had made to protect us from the adverse effects of these circumstances tends to kind of reduce. And this is what we have seen with any kind of a chronic non-communicable disease. If we take an example of analogy of that, say for example, diabetes. If you've got diabetes and if we have to kind of maintain our diet over long periods of time, take medications on a daily basis, we see that people, a large proportion of people, will not follow these recommendations at some point in time or the other. And there's enough research that has shown this. And this is not any different. I mean, we are 3 months, or what, 4 months, 6 months into the pandemic now, and we need to sustain these changes over longer periods of time. And so we are going to see people not maintaining or keeping to these guidelines over the period of time. So we have to be extra careful and mindful that we may maintain some of these, or we kind of maintain some of these changes as much as possible until we reach a zone where we can say, okay, things are reasonably under control, and we can kind of make some changes to these behaviors that we have to maintain, or these reasonable precautions that we have to take over a period of time. So if there is one key takeaway that I want you to take from this session is at least do these reasonable precautions, even if you're not able to do anything else beyond this. There are very clear places to seek help when it comes to COVID-19 or coronavirus. Don't trust your WhatsApp, your Instagram, your Facebook to give you an advice on what to do if you have got symptoms which might indicate coronavirus infection, like fever, cough, difficulty in breathing. The national number is 1075. For those who are in Goa, it's 1075 or 104 at the state level. Madhya Pradesh also has 104. And the other number that I have on the right of the slide, 011 223 07145, is for Delhi. If any of you are kind of working from any other states in India, please look up the numbers on the internet, and you should be able to find those. But even if you're not able to, 1075 is the national level helpline number for coronavirus. If you have any queries, please feel free to go to the toll-free 1075 numbers. The answers to your questions are not on WhatsApp or Instagram. The answers to your questions are on credible sources of information. Like in our case, at the national level, the Ministry of Health and Family Welfare, and at the global level, any guidelines that are put out by the WHO, etc. I just want to reassure people about your jobs and COVID-19. I think there have been some concerns around Sangat about losing your jobs if you are COVID-19 positive. Please be reassured that, and Pinaki can come in and kind of pitch in on that. But as far as I'm concerned, as far as I understand Sangat and its history and its ethos, no one is going to lose their jobs just because they are COVID-19 positive. So please do not hesitate to let your supervisor know if you have tested positive for COVID-19 and cannot come to work. Please do not try to hide that. And please, I know that everyone in Sangat is not attending this session. Please communicate this to everyone else that you are working with in Sangat who has not been able to attend this session. Reassure them that no one is going to lose their jobs if they are COVID positive. In fact, if they have got symptoms which might indicate that they might be infected with coronavirus, and because of that, because they're concerns of losing their jobs, if they come to work, they are putting other people at risk. Please do not do that. If the only reason you come to work, even though you have the symptoms, is because you're worried you will lose a job, please don't do that. Follow all the guidelines that have to be followed if you are having symptoms which are suggestive of coronavirus disease, and just inform your supervisor why you're not able to come to work. We will not. We will ensure that no one loses their job just because they're COVID positive, and no one will be discriminated against or stigmatized just because they have COVID-19 disease. And it's important to kind of remember this, because as the virus spreads and as we get increasingly more people who will test COVID-19 positive, we are seeing a lot of stigma and discrimination associated with that. And we have to be mindful that we don't add to that pandemic of stigma and discrimination that comes up. So be mindful that anyone can get the virus. What's important is getting treatment for it. What's important is for us not to be spreading misinformation about the virus and COVID-19. It's important for us not to be spreading quote unquote news about people in our communities or workplace who test COVID or coronavirus positive or test COVID-19 positive. It's very, very important. It's our responsibility not to be spreading any fear or panic around that. It's not our job to keep track of where our colleagues have been when they go out for field work. It's not our job to find out who has been exposed to coronavirus, potentially who has COVID-19, who in whose family and who in whose community has COVID-19. It's not our job to do that. Please remember, and we have already seen this happening in Sangat. News spreads like wildfire, we know that. Gossip spreads faster than that. And we are not doing anyone any favor by trying to spread misinformation. So please, working, at the end of the day, all of us are working in a healthcare sector, even within Sangha. So we have to act responsibly. And we shouldn't be the ones who are spreading stigma and discrimination within our organization or outside the organization. So that's kind of my bit on the larger COVID-19 scenario within India and its impacts on our workplace and the work that we do. And this is, as I said, this is not a complete picture. This is not a laundry list of all the things that are happening because and around COVID-19. These are based on some of the common issues that I've come across when I interact with or when we try to overcome some of the challenges that we are facing in the workplace. I'm sure there'll be other things that you might have experienced and you might want to bring up. I'm sure there are other things that will come up in the days to come as the virus spreads in our communities, and we'll tackle them and deal with those as and when they arise, provided you bring them to our notice. The last bit of my presentation is around mental health, and I've kept this last because many of us have worked in the mental health field for a long period of time, and many of us have come across some of these things independent of the COVID-19 pandemic. There is nothing specific or different that we need to be doing to take care of our mental health during the COVID-19 pandemic. A lot of these things are things that we have either practiced before or heard about before or read about before or indeed practiced before on ourselves or recommended this to our clients if we are clinicians providing clinical services within Sangat or as a part of research projects. So a lot of these things will come across as something that you have, a lot of these things are something that you will kind of see as pretty commonplace and things that you've come across as a part of your work. So I'm not going to spend too much time on this, but I'm also mindful of the fact that many of or some of you who are attending this session are not researchers or clinicians and so might not have come across some of these things. So I'm not going to spend too much time on this, but I'm just going to kind of reiterate some of these quote unquote common sense things which we need to do to keep ourselves healthy with regards to our psychological or emotional well-being over the coming years. So, few things if we are practicing or social or physical isolation, if you're working from home, etc. Few things that we need to do. Again, as I said, a lot of these are common sense. Keeping ourselves busy, having a regular schedule. Just because we are working from home does not mean that we do not have a regular schedule. Having a regular schedule, distracting ourselves from negative emotions by doing things that we enjoy doing. And this is just a few things that I have listed here, but there are a lot of other things that you might be doing which are not in here, which help to distract yourself and keep your psychological well-being uh, optimal. Rediscover your hobbies. I mean, a lot of times because we got sort of so caught up in our work, we have not been able to give time to our hobbies. This is a time to kind of find some time for your hobbies. uh, Maintain a healthy diet, drink plenty of fluids, and keep yourself physically active. Many times, because we are out of the lockdown now, but we might be working from home, so a lot of our time might be spent at, for many of us, might be spent working at the desk, which means that we don't find time to get some exercise. So ensure that we get some exercise. It does not have to be some heavy exercise. It could be within the home or around your homes, but get some exercise going, because as we all know, if we are physically fit, it also contributes to our emotional well-being. One of the big things that's kind of affecting people these days is a lot of rumors, a lot of misinformation that's getting spread on social media, and even the so-called credible news channels on television. So it's very important to remember that we have to have information, but we have to have credible information, because knowledge is power. And if we don't know something, it increases our anxiety, it increases our fears, it increases our worries. One way of reducing this fear is having credible information on, in this case, coronavirus or COVID-19. So be mindful of what the credible sources of information are, and increase your knowledge about coronavirus and COVID through those credible sources, and not through WhatsApp forwards or not through Facebook posts, not through Instagram posts. Do not follow sensational news channels or social media channel posts which may impact your mental state. I mean, for example, I have stopped watching any of the news channels on television for the past 3 months. I don't watch them at all. So be very critical of what you see. If you are not sure, check with people whom you trust about the credibility of the information that you get on the various channels that we have access to. Do not focus on who got sick and how. Focus on those who have not got infected, or those who got well, those who have recovered and are doing well. It's easy, especially now as we are going to see the number of cases increasing, especially as we are going to see number of people going, needing to go onto the ventilator, and the number of people who are dying because of COVID-19. It's increasingly possible that we will focus on these negative numbers. I've always maintained that these numbers shouldn't be going out there in the public. I mean, number of people getting infected, dying, etc. There's no need to put this out in the public domain, but on a daily basis. But it's happening. It's unavoidable. We are going to see posts coming out which are going to tell us about the number of people who are getting infected, number of people who are dying, etc. And it's human nature to focus on those. Try not to focus on those and try to focus, because the same posts also come out with numbers of people who have now tested negative, who are recovered, etc. Try to focus on those rather than the number of people getting infected or dying. And finally, stick to the known advice. I mean, the known advice, as I said, the most reasonable, most sensible advice that we have to follow is about wearing masks, hand hygiene, and physical distancing. And it is these things that people are not following and trying to follow some of the non-evidence-based advice that you're sharing. Handling difficult emotions, again, this is something that many of you who work clinically or worked on research projects where we have delivered psychological interventions will know about. If you are feeling anxious, practice deep breathing for a few minutes. Think of something that's calm and peaceful and slow down your mind or how your mind is functioning at that point in time. If you're feeling angry or irritated, count backwards from 10 to 1 or distract yourself by doing something else. Indeed, this is again not a laundry list of the various things that you can do to take care of your mental health. There are various other things that you might have done before and which might have helped. Do those. If you are afraid or worried or fearful of the situation, try some kind of what we call as cognitive exercises, which is basically asking yourself, is this under my control? If this is not under my control, there is no point in worrying about this. What about this situation is under my control? What is under my control is washing my hands, maintaining hand hygiene, wearing a mask, maintaining physical distancing. Am I unnecessarily worrying about the worst thing that can happen? Am I unnecessarily worrying about dying from the virus when we know that a large chunk of people who get the virus do not die? Am I unnecessarily worrying about dying? And finally, when I have been stressed in the past, not related to coronavirus or COVID, how have I managed? What have I done? What are these things that have helped me? Can I do those again and see if they help? Because most of the times, things that you have done in the past, which have helped you to reduce your stress, are going to work again. The situation that is triggering off the worry or the stress might have changed, but what you're experiencing, the stress, the fear, the worry, that remains the same, regardless of the trigger. To work on those experiences, because we can't work on the situation, right? We can't make the coronavirus go away. We can't make COVID-19 go away. What we can make go away are the experiences that we are having secondary to the situation. If you're feeling lonely or sad, talk to someone. Don't bottle it inside. Talk to someone you trust. And most importantly, if any of these things that you're experiencing remain for a long period of time and don't go away despite doing all of these things, then seek professional help. Seek professional help from people within Sangat. If you want to, you know that there are a lot of mental health professionals within Sangat. But if you have any help that you seek from mental health professionals in Sangat will be completely confidential. It will not be discussed with anyone else within Sangat, except as always, if there is any risk to yourself or to others, then that confidentiality might have to be broken after discussing with you. But that's an extreme case. But otherwise, anything that you discuss with a mental health professional within Sangat will remain confidential. But despite that, if you have concerns about confidentiality, please seek help from a range of sources that are available now, including COVID AV, which Sangat is a partner, an online platform that you know on which you can seek help. But you can also seek help face-to-face from other mental health professionals that you know about are and available within your community. But I would like to end with this. The situation, as we all know, is dynamic. Things change on almost a daily basis with regards to the virus, the pandemic, and our responses to it. What has more or less not changed right from the outset is our understanding of how the virus spreads. There are kind of now nuanced understanding of some of these things. So for example, how long the virus survives outside human body, etc. But more or less, we have clarity about how the virus spreads. And more or less, there is kind of very great clarity around how we can take reasonable precautions to prevent catching the virus, which is basically three things. One is hand hygiene, two is wearing masks, and three is around physical distancing. But outside of that, a lot of the things are changing. They will continue to change because what happened because of the complete or almost complete lockdown that we tried to implement in India is the peak of the pandemic or the spread of the virus was delayed. And now we are getting into that phase and we are going to see increasing numbers of people becoming positive over the next couple of months or so. All things going well, things should start tapering down by August and September. But again, don't hold me to this because this is an educated guess based on what we are seeing across the rest of the world. Things might be different in India, but this is what we know from the current evidence and current understanding of how the pandemic has evolved across the world. So the thing to keep in mind is the situation is dynamic, it's fluid. Keep an eye out on advisories that are coming from the government. Keep an eye out on the guidelines that are coming from the government. We at Sangat, the management at Sangat, will keeps a close eye on these things and we'll be sending you uh, any changes in the advisories or guidelines which affect us in the workplace or in our communities at regular intervals. But it's your duty as well to keep an eye out on things as they change and not purely rely on what I have said today. Things will change over time. It's our responsibility as an employer at Sangat to keep you updated on the situation, but it's also your responsibility as individual members of communities to keep an eye out on the situation and be responsive to those guidelines and missives and directives coming from credible sources. So that's all from me. I'm sure there are a lot of other questions that you might have. There are no guarantees that I will be able to answer all the questions. I will try my best to answer the questions if you have any. But if I'm not able to, I'm happy to kind of if someone collates the questions from me, Pinaki, at your end there, I'm happy to then kind of follow up on those and send or circulate responses to everyone within Sangat.
Thanks, Abhijit. I think it was a very helpful presentation. Of course, this was a topic which required a much elaborate kind of a treatment, but obviously due to the paucity of time, we could not touch upon all the issues. But I think you have taken up and in details, gave a detailed treatment to all the important issues, not only about the virus itself, but also about the mental health conditions, the stigma attached to it, and the organizational response, which we are, as you said, we are monitoring the situation. We have been giving regular updates and also written communications about the situation and what the organization wants to do or seeks to do. We have detailed that periodically. As you have mentioned, this is a very fluid situation, and obviously, no one really knows when the virus, when the effects of the virus or the impact of the virus will start ebbing. But I think we need to, as individuals, we all need to take the preventive measures required, which almost all of us know what are the preventive measures, and we have to uh, work not only when work but also lead our personal lives in a way that is as normal as possible. Obviously, we can't go back to the normal days which we used to in the pre-COVID days, but as normal as possible. Probably that is the new normal, and we have to accept it for several months probably. Over to the other participants who have joined today's session and any questions from their side. Most welcome, please.
Hi, I wanted to check, the policy on APS with respect to the situation. Do we have any approval for a special APS which is above and beyond the 24 APS that we get every year, in case the staff member or a family is sick because of COVID?
Yeah, I think we can certainly consider APS for people who have been infected with COVID-19. Sorry. Yeah, I hope I was audible. So I was saying that we will certainly consider APS for people who have been infected with COVID-19, or if some of their immediate family members have been infected or they're in the high risk category. So in that case, we can certainly consider APS for the quarantine period. The designated quarantine period as deemed fit by the respective state government, because some state, there is some side, some kind of difference between different state government guidelines, although broadly all of them follow the ICMR guidelines. But we can certainly, at least for the quarantine period, we will certainly consider APS.
In addition to that, on the quarantine, we have given them the work from home option for the 14 days.
Yeah, if they are asymptomatic, for example, so although they may be infected, but or their family members may be infected, so in that case, they can certainly avail the work from home option. If they are symptomatic or they are sick, obviously, or hospitalized, in that case, the work from home option is not going to be relevant. But otherwise, if they are asymptomatic or they are in the high risk category, for example, some of their immediate family members have been positive cases. In that case, they can avail the work from home option. So it depends, and they can always discuss with their supervisors, and we can take a call on that.
Thanks. It will be helpful if we could circulate, kind of a communication on this. That what to do when you are, if you're tested positive or you're sick, and how will this APS be treated? Since not everybody is on this call, it will be great if you could circulate a mail about the APS particularly.
COVID-19 response.
The COVID-19 response SOP communication was sent. It was already there, but we will again send it. Yeah. When it was already there, I think it was the first response.
That's the last page.
Yeah, last page in the first PPT we have sent. In that it was mentioned, but we will again circulate that. Yeah. Thank you.
Okay, I seem to have missed it. Thank you.
Anyone else from this hall?
There's a question on the chat.
Yeah, please.
Right, so I think there's a question from Supriya, which basically whether these basic three precautions that I spoke about are also sufficient for vulnerable people, especially older parents and toddlers, and also those who live with care for vulnerable people. I think the most important, in addition to these three things that we have been speaking about, the other thing to keep in mind for those who are vulnerable, especially those who are older, those have multi-morbid physical morbidities, etc. The other more important thing to remember is try to avoid as much as possible being in situations where there are crowds. Basically taking the physical distancing bit to slightly next level, in the sense that not to go out unless it is extremely necessary and essential, and even if you're going out, then to avoid crowds and maintain physical distancing very, very stringently. There are beyond that, there is nothing else that you can do with even with people who are vulnerable, because unless someone is tested positive, there's no other interventions that can be put into place for people. So it's basically, if we are looking at prevention, these three measures that everyone should be taking, and an additional measure being not going out of the house and being in crowds unless it's absolutely essential.
Thanks, Abhijit.
Hi, anyone else? Anyone else wants to ask any question or has a doubt?
Hi Abhijit, this is Calvin. Thanks, you have given a broad perspective, and in almost 360 degree you have covered in terms of. I think it's not easy. So we could able to understand what to be followed, and what is the precaution we have to take in terms of at what time the test is required, and in terms of emotional also you have given the tips how to be handled it. But today what I see is across the, especially Sangat being a young workforce, and in terms of though as one of the things Pinaki also talked about the pre-COVID, now we are the post-COVID-19. So the entire world and the skill and the work is being hampered due to the work what they are supposed to do. It has been totally taking a shift, or somewhere it has been stopped and they are being engaged in different work. So how do we engage the staff in a way uh, to eliminate the fear, and how do we skill? Like I think it's something like to reskill themselves, or unlearn, or to relearn. How do we take, because they are very much curious to know what is the future in store for them. So would you like to give something on respond on that basis?
Yeah, I think. Yeah, I think the thing with that is we probably might be jumping the gun in terms of thinking that everything, absolutely everything, is going to change post COVID. It might. I mean, the world might change completely, but I doubt that would happen. You would still have a lot of need for the skills that people already have. I don't think that, let's say, for example, if we have people who have been doing face-to-face counseling, that there's not going to be any role for face-to-face counseling, and everyone will have to learn how to deliver counseling over the phone. Or if we have had people doing outcome evaluations face-to-face using paper and pencil methods, I don't think we are going to reach, we can kind of suddenly wake up into a world post-COVID where everything has to be done remotely in terms of outcome evaluations. There are going to be some changes, and some of the things are going to remain the same. So, in terms of skilling up people, I guess a lot of that is already happening. It's inevitable. A lot of that is already happening within Sangha. A lot of people who are not working remotely using technology have started working remotely using technology. A lot of innovative solutions are being put together to find to kind of overcome barriers such as outcome evaluations. Okay, the dog is probably okay. Great. Oh no. Someone needs to mute their mic. Okay, fine. Yeah. So I guess it's not going to be such a changed world that everything in terms of skills that we had before have to be thrown out of the window, and then we need to learn completely new skills. I think we are going to go into a world where there are going to be and a hybrid need for skills. So someone who is doing face-to-face outcome evaluation also needs to learn how to do them on the phone. Someone who is doing counseling face-to-face also needs to know how to do the telecounseling. So there's going to be a need for hybrid skills rather than a complete replacement of skills with new skills. Um, and as it is, I mean, a lot, we were already kind of moving in that direction with a lot of the things that we were doing in Sangat before the pandemic started. So I think we have had a head start. I don't think we should be panicking and worrying about the marketability of the skills that we have in quote unquote the post-COVID world. But I also think it's our responsibility as employers, I mean the larger standard organization, but also our responsibilities as project coordinators, project leaders, program managers, principal investigators, to ensure that within our kind of projects, we are empowering our staff to build up those skills so that they are reassured about their, again, the marketability of the skills that they have. So I think that in a nutshell, basically my response is yes, we need to kind of develop new skills, but no, it's not a complete revamping of the skills so that there is no use for previous skills. There's going to be use for previous skills. We just need to update our previous skills with some new skills to make ourselves relevant in the, again, quote unquote, post-COVID world.
I have another question. Abhijit, could you please explain what is symptomatic and asymptomatic to all of us?
Okay, right. So basically, again, putting on my medical doctor's hat, we basically going to have a group of people. So there's a virus in the communities. We are going to have a group of people who are not infected by the virus, which is going to be a large chunk of all of us. Then we are going to have a group of people who are going to be infected by the virus, in the sense that we're going to have the virus within our bodies. And within this group of those people who have the virus in our bodies, there are going to be two subgroups. One subgroup is those who will manifest the illness or the symptoms of COVID-19. So we will get the fever, the sore throat, and all of the other symptoms that accompany COVID-19 disease. Within those, there are going to be those who will be mildly symptomatic, who will not have a very severe illness, but will still have the symptoms. And then we'll have the severe end of the spectrum, just like all of the work that we do, I mean, mild, moderate depression, etc. So you're going to have a mild end of the spectrum for those who are manifesting the symptoms. So these are the symptomatic. Within the symptomatic, we'll have mild, moderate, severe kind of manifestations. And then there will be those, the other subgroup of those who have the virus, but do not manifest the symptoms. And which basically means that we will not come to know that we have the virus until we have been tested. And so basically there might be people amongst all of us here who might have already been infected by the virus or are currently carrying the virus, but did not develop COVID-19 or have not developed COVID-19. They just carried the virus and we are asymptomatic. We are not having any of the symptoms of the virus. But although we are not carrying, we are not manifesting the symptoms, because we have the virus in our body, if we don't take sensible precautions, we are going to spread the virus to other people. So some of the precautions that we take are also to protect other people from the virus and not just ourselves. So if we have got the virus in us, we don't have the symptoms. And if we go around without a mask, when we sneeze or when we cough, we are throwing out the virus, which can infect someone else and who can develop the COVID-19. And so that's basically the difference between symptomatic and asymptomatic. So basically three groups, three broad groups: those who are not carrying the virus, those who are carrying the virus and are symptomatic or were symptomatic and have now recovered. And then the third subgroup, which is basically those who are carrying the virus, are asymptomatic, are not having the disease themselves, but can pass on the virus to other people who can then become symptomatic.
All right. Thank you.
Any more questions? I believe there isn't any chat also. No. So we can probably end the session. We
Sure.
initially.
I just wanted to
Sure.
say and acknowledge that these are difficult times. All of us are going through this. Uh, we have worries, we have concerns about ourselves, we have worries and concerns about our loved ones, our families, etc. Um, Please feel free to ventilate your concerns, talk about your concerns, talk about your worries with your supervisors. Uh, if you don't have any answers, if you don't get any answers, please feel free to escalate it upwards. Uh, uh, we will try our best to respond to your concerns. We'll try our best to respond to your worries, respond to your queries and your concerns. Don't try to keep them to yourselves. Don't try to find responses from non-credible sources because that will only add to your worries or concerns or indeed make you feel safe or reduce your concerns when they shouldn't have been. So please seek information from credible sources within or outside of Sangat and don't hesitate to speak to your supervisors about your concerns and worries. If there are issues around your job, around your employment, around Sangat's response to the whole COVID situation, please feel free to write to us and seek a response to your queries and your concerns. We'll try our best to respond to those. If we don't have the answers to all your questions, we will find the responses or answers to your questions and get back to you on those.
Thank you, Abhijit. I just wanted to add one more thing. We have already intimated this through a communication that anyone, if someone is infected with the virus and he or she works for Sangat, that is not going to affect his or her continuation in Sangat. I mean, so it's not that anyone will lose a job, lose his or her job due to COVID-19 virus. So, I mean, Abhijit also spoke about that. So let me reassert that this is. I mean, if anyone here, I'm sure probably no one has that kind of a dilemma or that kind of a fear or doubt. But if anyone has such a doubt in the mind, please remove that. And in case there is an issue in your close family member, or you think that there is a chance, slight chance that you have the risk of being infected with the virus due to some contact, some recent contact, please don't hesitate to contact your immediate supervisor. And I can assure you that whatever the conversations are, whatever the communications are, that will be kept confidential, and your job in Sangat is not going to be affected by COVID-19. We are not going to make it happen. I can assure you that. Thank you, everyone, and thank you, Abhijit, for the brilliant narrative. And I'm sure it was very helpful. You tried to be as comprehensive as possible within a short span of time. And thanks, everyone, for joining and for asking very pertinent questions. Thank you.
Thank you. Bye-bye.
ऑनलाइन जाने वाला उसने वीट नहीं किया उसका पूरा गाड़ी का सब